Hello, I'm Dr. Michael Chiorean. I'm a gastroenterologist at Swedish and the co-director of the Inflammatory Bowel Disease Center. What attracted me to medicine is probably coming down the family line, in that I had great examples in my grandfather and my aunt who are both physicians, and I think they inspired me not just in terms of professional careers and how they're approaching their job, their profession, and their calling, but also their incredible ability to help other people. And that level of satisfaction was something that I've never experienced before, and I think it was a magnet from me early on. My attraction to gastroenterology was essentially love at first sight. I think most of us recognize that there may be moments when they think that this is what they want to do. For me, it was a combination of having that moment, but also having outstanding mentors, both in my medical school and in my fellowship. So once I experienced that part of the medical field, I realized that that's the only thing I ever want to do. I think it was the combination of intellectual input, so actually working with patients, dealing with the medical side of things, which is very complex, but at the same time, allowing you the opportunity to intervene with endoscopic procedures. So that combination of the two worlds was a irresistible attraction for me. My approach when I meet a patient for the first time is to get to know them as a person. I think that frame will help you address their personal choices, their needs, their preferences, but also help you carry the conversation about their disease, the approach to their disease, the management, and how do they think about involvement as a team with the medical team on one side and the patient and their family on the other side. Crohn's disease and ulcerative colitis are complex disorders. The best approach to this is through a team. One thing that is exceptional about Swedish is that we have a team of experts that work in sync. It's the gastroenterology team, the colorectal surgery team, the pharmacy team, the dietitian team. We have an outstanding team of associate healthcare providers, including our nurses, our PCCs. All of this creates that environment where we can tackle these very, very complex problems in our patients, leading to very good results. You always learn something from a new case or a very complicated case, but you also have your share of satisfactions from successes, from patients who are doing very well, and patients in whom you have very good outcomes and basically restore their level of normality. You give them back the life that they always wanted to have. I have an interest in outcome research, which looks at the results of interventions, whether they're medical, surgical, and so forth, in patients with Crohn's disease and ulcerative colitis, at the system or at the population level. When I'm not at work, I like to sail. In fact, one of my dreams is to get a sailboat to sail to Hawaii, fish, hike, and bike.